So this week, I've been asked by friends, why should they get pap smears? They've had children, they don't need to have pap smears. I asked my friend, so you've had a baby, does that mean that you can't get cancer, bacterial vaginosis, you can't get HPV? She's like, what are those things? I'm like, exactly. The reason that I recommend women from the age of 21, whether you've had a baby or not, get a pap smear. It's important to get a pap smear to check for abnormal cells, for things like HPV, infection, inflammation, cancer. All that can be determined, or at least it's the first line of investigation towards any of the things I've mentioned. If you should have a family history of cancer, it's important that you get yourself checked. So who should have a pap smear? If you are 21 and above and you are female and you have a cervix, get a pap smear. 30 years old and above, and you've had pap smears with abnormal cells before, it's important that you get tested at least every year until you are cleared, therefore, and then take advice from your doctor moving forward. Cervical cancer is one of the cancers that, if it is detected early, you can do something about it. If you have HPV, your doctor or your gynae can advise further. Things like cone biopsies, LETS procedures, those things can be done to make sure that the HPV is removed. If you've had abnormal cells, you won't know unless you do a pap smear. Do your pap smear. If abnormal cells appear, your doctor will then send you for further testing, and that's the only time you can do something, because if you don't know, you won't be able to do anything about it. So ladies, take care of yourselves. Don't listen to people that say that because you've had children, you don't need a pap smear. Because you're above the age of 30, you don't need a pap smear. Everybody needs a pap smear. Like I said, unless you have your cervix or your uterus removed, or you're over the age of 65. If you're not in that category, get yourself checked. It's very important. Plus you get vitality points for it as well. Thanks. Bye.